Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe. This is a concise, well-crafted summary and it highlights only the important keywords. Overwhelming post-splenectomy infection. So what is this? First is the OPSI. So what is this meaning of the OPSI? OPSI, this stands for the overwhelming post-splenectomy infection, as we saw. So it is a serious disease that can progress from a mild flu. So it can progress from a mild flu and to a fulminant sepsis. So mild flu to a sepsis in a short time period. Next is the most common late fatal complication of the splenectomy. It is the most common fatal complication of the splenectomy and typically it occurs in 2 to 5 years. So 2 to 5 years of the splenectomy and increased risk of the patients with the malignancy and also the hematological disorders. Now, what is a normal spleen function? Normal spleen function, it includes the phagocytosis of the capsulated organs. Phagocytosis of the capsulated organisms. Now, the risk of the splenectomy, it includes the increased risk of capsulated organisms. So, increased risk of the capsulated organisms and infections due to the absence of the spleen. Then organisms responsible for the OPSI. This is the most common and Streptococcus pneumoniae is present. It is present and the other organisms, this includes the Neisseria. So Neisseria meningitidis and also the Haemophilus influenza. This is nothing but type B. Then we move on to the infectious progression of the healthy individuals. So healthy person will be infected from the Streptococcus pneumoniae and is usually cleared within the 5 to 7 days. Usually cleared within the 5 to 7 days. So how do you do the prevention? So there's a OPSI, it is easier to prevent and treat. So easy to prevent than treat, and prevention is through the vaccination. Now what is the best time for the vaccination? The best time will be to the vaccination against the S. pneumonia. This is the pneumococcal vaccine as well as the N. meningitis. There's the meningococcal vaccine, and the H. influenza, there's the HIV vaccine, and influenza, there's a flu vaccine, are strongly recommended and should be administered at the last 2 weeks before surgery. At least 2 weeks before the surgery, and in elective cases, or at least 2 weeks after the surgical intervention in case of emergency. For emergency, you can do it after 2 weeks. To learn and grow daily like this, please do subscribe.